Catheter Fixation Dressing, fixed dressing. In general hospitals, about 50% of patients use various catheters. It requires catheterization again if it slips out accidentally. In some cases, it may require a surgery, even put the life in danger. There are a lot of reasons to cause catheter slipping. How to reduce this complication with current nurse insufficiency? Traditional drainage tube is fixed by regular tapes. It usually causes catheters slipping off due to tape's roll-up or tape's adhesive weakness. Catheter fixing device only focuses on proximal end of catheter and distal end is not fixed. Fixation design of proximal end does not consider from the perspective of ergonomics, and its effect is not good. The chance of a drainage tube slipping is increased. Additionally, there are some fixation dressings without slots. The tube will be moved in the dressing with one-side adhesive. Long-term catheter fixation dressings. Fixed dressing have Type A, Type B, Type C, and Type L. Type A is applicable for fixation of catheter, deep vein, and PICC. Type B is applicable for all kinds of fixations of drainage tubes. Type C is applicable for fixation of urinary tubes. Type L is applicable for fixation of nasal tubes. Type A and Type B fixation catheter dressing have 3D slots. There are 3 sides with adhesive and surround. Type C is a double vein fixation catheter. It applies firmly and no sliding. Nurses can choose different types of slots according to different catheter fixation vein. The slot part has advanced adhesive, which can use repeatedly. It can be adjusted anytime without changing the dressing. The adhesive is hypoallergenic, permeable, elastic, and compliant to human body perfectly. Its fixation effect is better and safer than any other well-known brands. Type L nasal sticker series adopt aggressive permeable adhesive. It is not necessary to clean skin with volatile solvent or alcohol before application. No stimulation to the skin. Permeable adhesive does not affect breadth of skin and no residue. A special piece of foam for surrounding the tube is in the package in order to reduce the occurrence of a pressure sores on ala nasal. It can also avoid pressure sores on face when using with long-term A01 type catheter fixation dressing. Instruction for use: fixation of peritoneal drainage tube, etc. Select a position lower than drainage port on patient's belly, avoiding foot of scar. Peel off the release paper and apply on the skin. Open slot of catheter fixation dressing. Put drainage tube into the slot and leave suitable length of the tube outside. Then close the slot firmly. Slightly pull the tube to check its firmness. Fixation of deep vein catheter. Select a flat skin position. Peel off the release paper and apply the dressing on the skin. Open slot part of catheter fixation dressing. Leave suitable length of the tube outside. Then put the tube into the slot and close it firmly. Press gently. Fixation of stomach tube, nasal tube. Wipe both sides of ala nasal with a facial tissue. Peel off the release paper and put T-shaped part in the middle of nose and press gently. Hold the nasal tube and surround it with the end of the dressing. For the patient with the tube for a long time, could put a foam dressing on tube in order to reduce the chance of pressure sores on nose. It can also avoid pressure sores on face when using with long-term A01 type catheter fixation dressing.